do that, we're going to do something different this session, and we're going to play a short, it's a 2-minute video that demonstrates kind of how RNA vaccines work for COVID-19. So hoping that by showing this before we go into Q&A, it might help give some context for some of the questions and responses that you're going to hear. So we're just going to play that, and then we'll jump into Q&A.
SARS-CoV-2 is a novel coronavirus that is responsible for the COVID-19 infection. The virus works by entering healthy human cells through the crown-shaped protein spikes on its surface. A promising candidate for the treatment of COVID-19 is a messenger RNA-based vaccine from Mrna Medical. Messenger RNA, or mRNA, are strands of genetic material similar to DNA that ribosomes in the cell use to synthesize proteins. Moderna's mRNA vaccine contains the instructions to synthesize the crown-shaped protein spikes on the surface of the SARS-CoV-2 virus. The vaccine is encapsulated into a lipid layer that allows it to enter the cell. Once inside the cell, the mRNA are released and ribosomes in the cell read them to synthesize the virus's spike proteins, which are then released from the cell. The spikes themselves are not harmful, but the human immune system perceives them as though the body has been infected with COVID-19. In response, the immune system produces antibodies against the SARS-CoV-2 virus. In the presence of an actual COVID-19 infection, these antibodies prevent the virus from entering a healthy cell by attaching themselves onto the spike proteins, thereby blocking their entry into the healthy cell and thus creating immunity.
Thanks, Mike, for sharing that. All right, so hopefully that is helpful. Would love your feedback at the end about that, but let's go ahead and jump into our Q&A. So we have 2 really exciting panelists today that will be answering questions for us. So I'm going to give them an opportunity first to introduce themselves. So I want to start first. We have Dr. Rachel Bernard from the Chicago Department of Public Health. Dr. Bernard, do you want to say a couple of words about yourself?
Yeah, great. Hi, everyone. I'm so glad to be on this call, and thank you for all the work you're doing. It's super important and critical to this response, so thank you. So I'm Rachel Bernard. I'm a medical director here at CDPH. I'm working on the coronavirus response in a couple different areas, also working on vaccine, and happy to field any questions that you guys have and try to just get some good answers going for you.
Thank you, Dr. Bernard. And we also have Dr. Linda Forst from the UIC School of Public Health. Dr. Forst, you want to introduce yourself? You might be on mute.
Sorry. Okay, I apologize. Hello, everybody. My name is Linda Forst. I'm a faculty member here in the School of Public Health and in the College of Medicine at UIC. I'm really excited to see all of you here because this response and getting this vaccination rolled out is not possible without you. So it's really wonderful to work with you here. I'm trained in internal medicine and occupational medicine, and I'm still practicing in a clinic at UI Health. And I also teach and do research in the School of Public Health.
Great. Thank you, Dr. Forst. All right, well, let's jump in because we have a lot of questions. Dr. Forst, I'm going to start with you. Can you talk about what does efficacy mean when talking about a vaccine?
Yeah, efficacy is really the same as effectiveness. So the term efficacy is used when it's about a clinical trial, when you're testing the vaccine. So efficacy is really like how effective is the vaccine under testing circumstances. So really it's similar to effectiveness.
Dr. Bernard, I'll send one over to you. So can pregnant women get vaccinated?
Yes, they can. So basically, the way that the CDC has said this is that we don't have a lot of data explicitly on pregnant people, because pregnant people, if we knew they were pregnant, they weren't included in these trials. But we do have some information just from having studied these mRNA types of vaccines on what sort of interaction they might have with pregnant people. And there are not any concerns right now in terms of pregnant people taking the vaccine. We do know also that people who are pregnant, if they get COVID, are more likely to have more severe COVID, be hospitalized, or have side effects to the fetus. So at this point, the CDC is saying the benefit of the vaccine is likely to outweigh any risks that are not known about the vaccine for pregnant people. So we are recommending it for pregnant people. We do also note that people can have a discussion with their physician about what their own risk factors would be for getting severe COVID, and whether they're in their doctor's discussion with them, they think they should get it or not.
Thank you. So I'll let you all decide which one who wants to tackle this or both, but can you talk a little bit about or share some history about vaccines and why there's so much distrust in them?
Rachel, you want to go?
I mean, I could probably talk about this for an hour, but I mean, I think there's a lot of reasons why we're hearing this, and they're warranted, in my opinion. So there's a lot of areas where the medical community hasn't done right by our Black and Brown communities. So I'll kind of just, I think some of it has to do with medical racism, and how the medical system hasn't really been forthcoming always with people from Black or Brown communities. And there's, lots of studies that say that they're not treated the same in healthcare encounters. We're familiar with Tuskegee, or people like Henrietta Lacks, where people were, manipulated for research. So there's a history here, which is, I think, what people are bringing into this sort of discussion. And we're aware of that, and we have to acknowledge it as part of this response. Vaccine history is its own kind of like the vaccine, anxiety is its own kind of separate branch, but this kind of all starts with, and you can jump in here as well, Dr. Forst, if you want to, but this kind of starts with an initial kind of false study, like a study that was later debunked, that came from the Lancet, which is like a large organization in the UK, that published a study saying that they believe that there was some linkage between autism and vaccines. This has been debunked so many times, and it was a poorly designed study. And like anyone who studied it, like we know now, we never would have published this study. It's crazy that it was published at all. But the mythology kind of carries on in our communities because it got out that way, and a lot of people are concerned about it. So I think we're dealing with kind of like the vaccine mythology that all started with this initial autism study many years ago, and then also like the history of medical racism and unfair community treatment from the medical community.
And we have lots of questions, so I might be jumping around a little bit in topics, but will these vaccines be given yearly?
It isn't really known yet whether they'll be given more than currently. It depends what happens with the virus. The virus is so new, but if you look at the flu vaccine, the influenza virus, it mutates, and what people get exposed to in a next year is sometimes not the same as what they were vaccinated for. And so the vaccine has to be reconstituted and given again. It isn't really known whether that will happen with the coronavirus. So it just remains to be seen, really.
And I believe we asked about pregnant women, but if a woman is nursing, can she take a vaccine?
Go ahead, Rachel.
Yes, she can. So it's similar to pregnant people where, like these studies will be ongoing just to make absolutely 100% sure, but there's no reason to think that there's any sort of, nothing is infectious at all going to the lactating mother. And there's no concern of anything being passed on to the child through any lactation. It's absolutely allowed.
And how do we know which vaccine is the best out of the Mrna and the Pfizer?
That's a really good question. That's a question I tried to answer for myself and people that I know. They're very similar, really. The efficacy or effectiveness of the Pfizer is 95% in their study, and of the Moderna is 94.2 or something like that. So they're really similar. I don't think there's a difference, probably.
I totally agree. I think that they're both excellent, and they're very, very similar. In fact, like so similar that, so in the medical community, when these big studies come through, a lot of times we question, like, are these results reproducible? Meaning, if you do the same study, where are you going to get similar results? And the fact that these two vaccines from different manufacturers that use similar technology had such similar results means that, like, this is like, we trust these data because they were basically almost identical in a lot of ways between the two different manufacturers.
And Rachel, I think this is a question for you. Can you talk about, what CDPH will be doing to help address some of the cultural pushback and lack of trust?
Yeah, I mean, it's definitely on our radar 100%. So our approach has really been to work with partners. And so to look at people who are respected, known, have connections within their communities, looking at every zip code, all of our partners, aldermen, mayor's office, every single community organization, organizers, we're ready, we're looking for partners. And so we want to gather concerns. And then, like Dr. Arwady was saying, like, bring us your questions, bring us your concerns. We want to address them with as much transparency as we can. So I think, like, partnerships, community workers, we're looking at anyone who has a voice, anyone who can help us in any way to get into the community about this.
I also want to say that it depends on you guys a lot, because you're the ones that are out in the community talking to people. And so the better that you can arm yourselves with knowledge, and you feel comfortable talking to people and explaining things to people and listening to people, I think that's really what's going to count here.
And can you speak to what is in the vaccines, and is it live?
Yeah. I could talk about that for a minute. So mRNA, messenger RNA, is a little section of code of RNA. So you probably know what DNA is. So DNA is your code for that makes everything in your body. And messenger RNA is a little segment that was translated, from the DNA, and it codes only for a protein in this case. So the messenger, ask the question again so I don't get too far afield here.
Yeah, just what's in the vaccine, and is it live?
Is it live? So the code is really a segment of a chemical. It really isn't alive. It's just a segment of a chemical that codes for the protein, that spike, that red spike that you see on the virus's surface. So so that isn't alive, and then it's embedded in kind of a fatty substance, a lipid substance that gives it volume so that it can be injected, and it gets injected into the blood, goes into the bloodstream, and that fatty substance allows that to get absorbed into cells. So it's not alive. There's nothing in it that's alive.
And so we have a couple questions about safety. Can the vaccine affect fertility?
The answer to that is no also. It doesn't get into the nucleus of cells. It doesn't alter genetic function at all. It doesn't get where it would need to go in order to have to interfere with fertility.
Yeah, agree. And we haven't seen any evidence of this at all, like nothing, not one iota of this.
Another safety question. Someone wrote that they were doing research and they found that the vaccine can cause an immune disorder disease in the long run. So is that true?
the vaccine, not the virus.
Yeah, the vaccine.
Vaccine. Okay. So, you know, there are theoretical concerns about that, but actually the messenger RNA is doing what your body normally does, which is inducing antibodies to be made. It's inducing your immune system to see that protein as foreign and make antibodies to it. And then that messenger RNA, it has a very short shelf life, or, you know, life in the body. So really it disappears. So it isn't getting your body to do something that it doesn't already do whenever it sees something foreign. So there is no reason to suspect that it would somehow have any long-term effect.
A couple of efficacy related questions. How long until we know the efficacy of the vaccine?
Well,
Long term.
yeah, long term. You know, the time just has to pass, really. You know, we know the vaccine is effective 95% in 95% of people for many months now. I think the first vaccines were given, when were they given? In December, November, I want to say. So from November to present, they're 95% effective. Looking, you know, we just need more months out there to see how long they remain effective. You know, there's no way to shortcut that.
Yeah, absolutely. And you know, the way that we get this information from the studies is by watching people, right? So we give the vaccine and then we see, tell us everything that happened, what side effects did you have? We're documenting everything. So we could, you know, people can guess, but what we'd rather do is like, let's actually look at the data, what actually happened to people who got the vaccine. We're going to give like the true transparent data on how far this efficacy lasts. So yeah, so what we know now is 95%, which is awesome, but we'll be continuing, all these studies are ongoing and they're all going to see, when did people get COVID? Did people get infected with COVID? Did they get sick from COVID? Even if they got the vaccine already, we're still collecting all that information. And then there are going to be more studies saying, here's how long we've noticed that it's been lasting.
Next question, how effective is the vaccine against the new COVID mutation?
It should be effective against the new COVID mutation because the mutation of the virus that's in the UK right now, it still makes the spike protein. And the vaccine, you know, works against the spike protein. So it should be equally effective against the new strain.
And Dr. Bernard, I think this might be for you. How long will it take to vaccinate all Illinois residents?
It's a great question. I wish I had an answer for that. It all depends on how much supply we get. So right now we're like Dr. Arwady was saying, you know, we're only getting several thousand doses every week. That will increase as the manufacturers start increasing more doses, but also if more vaccines get approved. So if more types of vaccines are approved, all of this will speed up. If they start making more doses, all of this will speed up. If we get vaccines from other sources, that will speed up. So it's just kind of always a moving plan over here in the city, but we're working on it. We want to vaccinate everyone for sure.
Have either of you taken the vaccine? And if so, have you had any side effects?
Yes. I wanted to get it on the first day, but I was only allowed to have an appointment on the third day. And people at, you know, where I work are busting down the door to get the vaccine. So all the healthcare workers and people that work in the hospital and clinics want the vaccine here. I got the vaccine. My husband's a physician. He got the vaccine. My father is 101 and lives in a long-term care facility and has a caregiver. He got the vaccine and she went and got a lot of her friends who were worried about getting the vaccine, and they went together and got the vaccine as well. So I'm a total proponent. I'm all in for this vaccine. And I didn't, you know, I had a really sore arm. Like, it didn't bother me when I got the shot, but that night when I was sleeping, I got a very sore arm that lasted, I want to say, about 12 hours. And then that went away. And maybe I was a little like low energy for part of the first day. But after that, it all went away. My 101-year-old dad, who got it 2 days ago, is just doing great.
That's awesome. Yeah, I actually have not had it yet because I'm working by a computer and I'm not seeing patients right now. So, we're also following all this 1A priority too. I might end up vaccinating people, in which case I will be vaccinated myself. But I have a family full of healthcare workers and my dad also got it. And he said it was fine. Like I barely even noticed anything. And I know a lot of doctors, obviously, because I'm a doctor, and all of my friends who have gotten it have said it just a little tenderness basically. And I haven't personally heard of any personal acquaintances that needed to call off work or anything like that. So I think we're seeing that it's quite mild in terms of side effects.
Thank you. And well, I did not get the vaccine, but I will say my sister is a nurse and she got it, and she said she took a nap the next day and she never takes naps. So that was her only side effect, was that
she probably deserved a nap though.
Yeah, she was a little tired. So great. Thank you. Let's see. So let's see. We have heard that the vaccine has caused partial paralysis in some cases. What can you say about this?
You know, there were a couple of cases, I think, in the Pfizer trial that had partial paralysis, but I believe they resolved. And also the one or two that didn't resolve, you know, it's always hard to know whether that's connected to the vaccine or not, because it's a condition that can happen in the general population. And when you're vaccinating tens of thousands of people and a couple people have a symptom like that, you can't really know for sure if it's from the vaccine. So there's a lot of attention being paid to that. There haven't been additional cases from the first descriptions that came out that got approved by the FDA, as far as I know, but that's being watched very carefully.
Yeah, absolutely. So you might be talking about like the Bell's palsy cases that were reported, which is like a partial paralysis of the face. So there were a couple cases reported in the trials, but it was not higher than just the regular rate in the population. So like, people just sometimes just get Bell's palsy. Like I have a friend who's like around my age, 30, who just got it for no reason, no infection, nothing, right? And that happens sometimes too. So like the rate of the people in the trials, it was, I think, 4 people total, and it was not higher than the rate of the population. But we'll always keep monitoring that, absolutely. And if it does come up, we would report on that for sure. But right now we have no evidence that it's higher than the rate of the regular population.
So not exactly a vaccine question, but this is a good question. See if we can answer this. But so we're saying that this new mutation is easier to spread than the current strain. How is that possible, that it's more infectious or spreads more easily? Do you have insight?
I actually don't know if I have a good answer to that question. I think like what they're saying is that like the R value, meaning like the number of people that it infects, is higher. But I don't know if we know exactly why that is yet. Certainly it's a huge area of interest. It could be related to like the amount of virus that gets in, like or like the amount that it's replicating, or just that it's the mutation makes it easier to get into your system. Or do you have any additional comments on that, Dr. Forst?
Yeah, I was going to say about the same thing. Viruses get into cells because they're sticky, and there are qualities that are coded for by DNA, by RNA in this case, that make them stickier. And so it might be something about that it's stickier and it just gets in more readily. But it isn't really worked out yet.
Great question. A couple more efficacy questions. So how would not having the vaccine for children affect a household who may get the vaccine but not the children? So if there's adults in the home and they get it and the child doesn't, how would that impact things?
I mean, I think at the beginning, we're going to see a lot of households that have one member vaccinated and others not because of the way that people are falling into different priority groups. What we don't know 100% yet is whether this vaccine prevents like asymptomatic spread. So like, so I can't say for certain that one person getting vaccinated will reduce the risk of the other people in the household getting it. We expect that's probably true, but we're waiting to kind of see how the data goes on that. So I think, you know, we're going to have these families where some people are vaccinated and some people are not. And we're hoping that that means that there will be some protection given to the rest of the family members. But as soon as these children trials come out showing that the vaccine is safe and efficacious for them, we'll be interested in vaccinating them as well. We're just not there yet.
Right. I would say also it depends a little on the age of the kids. So it seems like very, very young kids might be different in terms of their ability to contract and spread the virus than kids that are in older ages. And so you can look out for the data as it rolls out on that front, because there will likely be a difference between kids that are over 10 years old and kids that are less than 10 years old and infants in terms of their ability to, you know, how much they contract this disease and how likely they are to spread it. But all of that is coming out as it progresses.
Another question. So can you spread the virus if you've been vaccinated? So if you're asymptomatic and you have COVID, but you got the vaccine?
Probably no. If you get the vaccine, let's say you're fully vaccinated, you have two doses, and so you're fully vaccinated, it's 3 weeks after your second dose, then your likelihood of catching COVID, if you're heavily exposed to it, is 5%, right? Because you're 95% protected. If you don't catch the disease, you're not likely to spread the disease. Really,
Yeah.
you couldn't spread the disease if you don't catch it yourself.
Mm-hmm. Yeah, and I think that like we just want to follow like a kind of exactly what the studies have proven. So the studies didn't necessarily look at people who are asymptomatically infected. So we know that it's 95% effective at preventing you getting sick. We don't know that it's like 95% of you getting infected per se. We're still like kind of like threshing that out, but we know that it's 95% effective of you getting sick with COVID, having symptoms, being ill. So we're hoping that it's true also that it prevents asymptomatic, like you catching it and spreading it. We just need a little bit more data to kind of come through to be able to say that confidently.
I'm going to try to combine a couple questions here because there's a few questions about, you know, where are the ingredients, or what are the ingredients, and where can folks find the list of ingredients? And then also, are there any human stem cell or blood cells in the vaccine?
Okay, there are no human cells and no blood cells. There are no cells in the vaccine, period. The vaccine is this strand of messenger RNA, and it's like embedded in a blob of fat, basically. And there are no cells there. The ingredients of the fat, I'm not sure, but you probably can search. I bet you can.
They're posted. Yeah, they are.
Posted.
I mean, it doesn't, honestly, like, you know, we're both doctors and like, I don't like, these terms don't necessarily mean anything to me. They're like very specific scientific terms of like what type of lipid and the names of the salts. But they're all posted and easy to Google. The CDC has posted all of the lists of ingredients for both vaccines that are approved. But it's, yeah, exactly like she was saying. It's mRNA. It's a couple of salts just to keep it stable, and it's this lipid, which is fat, to keep it to get it into the cell and make sure it's used correctly by the cells.
And let's see, how long will someone be protected from COVID-19 after getting the vaccine?
Yeah, that's the $1 million question, right? At least 6 months, it looks like, since it started. Let's see, November, December, January. Oh no, 4 months is as much as we know right now, but it will just take time to follow out people. Yeah.
Yeah, we're going to keep watching and see, and they'll keep publishing data on that as well. And we'll make those announcements as we know them. And we'll see like what the manufacturers and the scientists say. Like it may be that this is all that you need for the pandemic. It may be that we end up giving like booster shots in a year or 6 months. It will all just depend on what we see, how much people get COVID in the group that got vaccine, how much do people get COVID in the group that didn't get vaccine, and like what does that data tell us about giving additional shots, whether that's necessary or not. So stay tuned.
Okay, a couple more safety questions came in. So if you're asymptomatic and you get the vaccine, will that increase your reaction? So like, will you have more side effects if you get the vaccine and you're an asymptomatic?
Meaning that you have COVID and you get the vaccine while you have COVID.
Yeah.
It shouldn't affect the reaction at all. If you get COVID, you know, when people get COVID, they get varying amounts of COVID. And so they probably develop varying amounts of immune response from getting the infection. The goal of the vaccine is to give you a defined and known amount of the COVID, a known amount of the vaccine so that you'll produce the antibodies to the spike protein. Because we don't know how much COVID a person gets when they get infected, we don't really know how good their immune response to that will be. And so the vaccine really, you know, maybe enhances that in individuals that didn't get a good immune response from getting the infection.
Yeah, I think there's just a couple of kind of like infection control notes for this. The CDC has advised that people who are in quarantine should not be vaccinated. But that's not really due to this like symptom thing that you were asking your question about. It's more about let's making sure that we're keeping our vaccinators safe. So if someone is already on quarantine because they had a close contact exposure, they shouldn't be coming in contact with a vaccinator. But as soon as they're off their quarantine, they can be vaccinated. And even people who are ill with coronavirus, so people who are infected, we know they're infected, they're sick, even those people can be vaccinated once they're out of their isolation period and feeling better.
So Dr. Bernard, I think these are questions for you. So will there be mobile vaccine opportunities for communities that are being heavily impacted by COVID?
Yeah, so this is like a gigantic operation here at CDPH. We are working all angles, everything we can, tons of vaccinators, hospitals, clinics. We have city pods where we're going to be vaccinating people, and we've started that. Mobile sites is part of that plan. There's just a ton of different pieces working. And so yes, I don't know exactly where those are going to come in the timeline, and they'll be just one small part of like a huge, massive, involving every part of the health department, like all health systems in the city to get people vaccinated.
A couple more safety questions. So there's a lot of questions about how does this vaccine affect people who have allergies?
Yeah, I can talk about that. I have a lot of allergies, and I've even had an anaphylactic event when I was younger. And it shouldn't affect people that have allergies in any way. There's nothing in the vaccine that's allergenic in general. And it doesn't, it doesn't overlap or cross-react with anything that is. So allergies per se are not a big concern. There were 2 cases of anaphylaxis. Nobody really understands why that happened. That's very easy to treat. If it's going to happen, it happens fairly quickly. That's why people are asked to stay for 15 minutes. When I got vaccinated, I stayed for 30 minutes just to be sure. But that seems like an idiosyncratic kind of reaction that, isn't really expected to happen very much.
Is there any data showing that certain groups should not get the vaccine?
Really, like, no. I mean, so the people that we're not vaccinating are children because they haven't been approved and studied, but they will be studied and approved at some point down the line. And then the only real contraindication is like if you know that you had anaphylaxis, which is like a severe allergy response to the vaccine itself or to any of the ingredients in this specific vaccine. Everyone else has like caveats and how they can be vaccinated. That's the only group that we're saying, you know, maybe not for you.
Right, even cancer patients can get the vaccine. The problem with some cancer patients is that they won't mount the right antibody response. And so the vaccine might not be effective in them, but it doesn't appear that it would be dangerous to them. So if for people that have immunologic diseases or cancer, they should talk to their healthcare provider about that and get advice from them. But really the biggest risk is that the vaccine won't work in them.
And just one note, in our last session, there were a lot of really specific, questions asking about, their specific conditions. And Patrick shared that CDPH will be putting together more guidance and resources. So for folks that are, want to know about their shellfish allergy or other things, there'll be more materials to share post-event.
Yeah, and for allergies, I think like if you guys are doing outreach, it's what I'm telling people is just know what you're allergic to and know what reaction you had. So like know that it was shellfish, know that it was hives, bring that with you into your vaccine site and make sure you have that readily available to whoever you're talking, whether it's your doctor or if you're going to vaccination pod, make sure that you have that information with you.
Great idea.
Next question, can pets spread the virus to people? And if so, can they get vaccinated?
I've never gotten that question. I think what's just like, we're in vaccine shortage time right now. So we're going to be vaccinating people for a long time. So I don't think they've even considered doing animals, but it's an interesting question.
And has there been a case where an animal has spread, like a pet has spread COVID to an owner?
I don't think there's a known case. I've read about it a little bit, and I don't think there's a known case of an animal spreading it to an owner.
Yeah, I would agree with that. I think I've heard of some like animals getting infected themselves, but not really being like a source of spread.
So question, why do we say it's not okay to approve the vaccine for children when they haven't been studied, but it's okay to recommend for pregnant women when they haven't been studied either?
That's a great question. The reason is that pregnant women, the physiology of a pregnant woman is the physiology of an adult. And the way the vaccine works, doesn't enter the system in a way that would affect the pregnancy. So it doesn't, it's the risk of getting COVID if you're pregnant, the risk of the adverse health effects from getting COVID if you're pregnant are pretty high. And so it's safer to get vaccinated than it is to get COVID.
Yeah,
so
absolutely.
It's a benefit,
Yeah, absolutely. Exactly what you said. It's like, and this group we know is high risk and we don't know about any risk at all to pregnancy. So that's why the CDC has said it's much better for the mother and the fetus to get this if they can. Just it's good to have a discussion with the doctor, like the OB or the primary care doctor that the woman is involved with. As far as children go, like we're just not seeing as many cases, as severe cases, as many hospitalizations as adults. So for them, we're going to be, a little bit more slower and making sure that the benefits of vaccination in them outweigh any risks. Where exactly like we said, we're adults, like we kind of understand how this works in adults a lot better, and we know that it's more risky in adults in general.
Yeah, and you know, a few pregnant people did sneak into the clinical trials. They didn't know they were pregnant, or they tested negative for pregnancy, and then it turned out that they were pregnant. And that handful of women did not have any problems with the vaccine.
Thank you. Dr. Bernard, I think a couple more questions for you. So will the vaccine be mandatory for anyone?
Yeah, I think that's a great question. And I think this answer is going to change over time. Like, the city is not going to make this mandatory. Where this can kind of come later down the line is after the emergency use authorization is over and the FDA approves this, then a lot of people can choose to start making it mandatory. So employers, for example, like a hospital, could make it mandatory then. We're seeing some discussion about like airlines wanting to make it mandatory for flights. So it's possible that like businesses who are offering a service might make it mandatory for a service. But like the city is not going to require that like everyone in the city gets it. So it's kind of more just like who decides to like employer-wise opt into that in the future. But that's not happening at all right now.
Yeah, the EEOC actually opined about this Equal Employment Opportunity Commission, and said that probably private employers are going to be allowed to require that. But so far, it's just not rolled out that way. Hospitals, you can imagine that hospitals may want to require that among healthcare workers so that they limit the spread in a healthcare facility. But I think that none of that will happen for several months until there's more, you know, as Rachel says, until more people are vaccinated and we really, we have enough vaccine to actually require it and, you know, to service people, then we'll start being able to address that question better, I think.
I saw in the news that Chicago has only used a fraction of the vaccines received so far. Does Chicago have the capacity needed to vaccinate people quickly? If not, will more people be hired?
Yeah, this is a great question. Let me just start by saying it's not a Chicago thing. And actually Chicago, if you look at our rates of vaccination, is doing really well in this capacity. Also, that specific percentage is a little bit, it's kind of not the best percentage to look at, because what happened was you guys might be familiar with the Pharmacy Partnership Program. This is our program that's vaccinating people in nursing homes. They're doing like 3 clinic sites once every 28 days apart, because they're trying to do, you know, both doses. If they didn't get someone on the first clinic, they're going to get them on the second and the third clinic times. So we gave them all of the vaccine that they need for those whole 3 months of visits all at once. So they're just going to like hold them and have them for these seniors who need it. But because of that, like those vaccines won't be given out right away. So there's kind of like these like nuances to that, but like they're a very high risk group. We want to get them vaccinated as soon as we can and for them to run efficiently. So we gave them all their vaccine. CDPH, the Chicago Health Department, has distributed 95% of the vaccine that we've received. So that has gone to hospitals, it's gone to this pharmacy partnership, it's gone to FQHCs, which are clinics in high-risk areas, for them to vaccinate their own staff, and our own pods for us to vaccinate healthcare workers. So it's getting out there. It's kind of just coming. Once it gets to these hospitals, they have to vaccinate people themselves. And then there's also a reporting lag where like they're really interested in vaccinating people. They have like 24 to 72 hours to tell the state that, hey, we actually did use this vaccine. So it's always going to be a little bit behind what we've actually done, if that makes sense.
Is the vaccine safe for those living with HIV?
Yes.
Yes, it is. I don't have anything else to add.
Will I still need to wear a mask after getting a vaccine, and when will I not need to? Do you have any thoughts on that?
Yeah, that's a great question. I think that this is kind of going back to that point of if we knew that this was keeping you from getting an asymptomatic infection, that might be a little bit different. But since we don't totally know that yet, and it's possible that you get the virus, but you just don't get sick at all, it's just, you know, kind of hanging out on you. That's the reason, well, one of the main reasons why we're saying even after you yourself are vaccinated, you still have to wear masks, you still have to do social distancing, you still have to wash your hands, you even still have to quarantine if you've been exposed. So until we kind of know, is this preventing asymptomatic infection, then that might change a little bit. But even we're kind of looking like from a population standpoint. So even if like you personally are vaccinated, the population rules will probably not change until we've gotten enough people vaccinated that we've made the population safer.
Is the vaccine free or covered by insurance?
It's free.
Both things, yeah, both things are true. Sorry, go ahead.
No, you go.
So the federal government has said we are not billing patients for this, period, the end, and that we're sticking to that. So patients will not receive any bill for this. What might happen is they might bill your insurance to just pay for the administration of the vaccine, not even for the vaccine itself, but just like, you know, you took up an office visit or whatever, they're going to bill your insurance just the time that you were in the clinic. But no cost, $0 cost going to patients on this.
See, I know I missed one. How long does the vaccine stay in someone's system?
I don't know exactly how long, but it's pretty short. Again, you know, the lipid envelope that the RNA is in, you know, falls apart, kind of dissolves right at the beginning after the RNA is inside the cells. And the messenger RNA is probably, you know, coding, kicking out proteins for a pretty short time, and then it denatures and it doesn't work anymore. I don't know exactly how long, but I think it's pretty short.
Yeah, the estimate I've seen is like a couple days for the mRNA itself, but like your body's response lasts a lot longer, right? The antibodies that your body has made in response, that's what's lasting, and the immune response, the memory that your immune system has.
Let's see. So many great questions. I think we might have covered this, but it's come up again a couple of times. So what are the most common side effects of the vaccine?
Go ahead.
Yeah, so what we've seen basically is what we call like local reactions. Local reactions means it's just like going on where you got the vaccine, not really affecting the rest of your body. That's the most common. So just like Dr. Forst was saying, maybe some pain or tenderness around the vaccine site. I've seen a couple people have like a little bit of redness, almost looks like a mosquito bite or like one tiny little hive that goes away after, you know, like 24 hours. That's most commonly what we're seeing. And then these kind of like almost like cold-like symptoms where people just feel kind of achy, tired, a little bit of low-grade fever. Those were the most commonly reported side effects. All those types of side effects are good because what they mean is that your body is noticed there was something there, working on it, trying to respond, saying like, hey, Rachel, there's something weird going on in your body. So like those sorts of kind of like fatiguey, kind of like not feeling so great symptoms for one day are a sign that your body's responding well to the vaccine.
Yeah, one other thing is that people are having a little bit stronger side effects on the second dose of the vaccine. So that's to be expected. You know, most people don't have much of anything on the first one, and then if they're going to have effects, mostly it's on the second one.
Mm-hmm. Yeah, absolutely.
And again, it's your immune system acting. You know, it's the reaction to the vaccine that's making you feel that way.
Totally. And they've also noticed that people who are in older age groups didn't as commonly experience those side effects. So these side effects were more often reported in younger people, actually.
I think this is both a question and a suggestion. So are there more plans to put commercials out about the vaccine similar to the video that we showed just before the Q&A on how the vaccine works?
So I don't know about commercials, like we would like, it wouldn't be like a commercial advertising Pfizer vaccine that we would do, but we are doing like a ton of media stuff. So Dr. Arwadi if you guys are not familiar with the website, I know everyone says look at our website, but our website's actually like pretty good, I think. And it answers, like, there's a lot of FAQs. The FAQs are all like, hey, what questions did we hear? Let's put them on our website so that anyone else who might have these questions can look at them. The FAQs are good. And then Dr. Arwadi is actually making videos to answer some of those questions that are also posted there. So if we hear like certain questions enough, she can make a video response to that you could just like watch on the website as well.
A couple more safety questions come up. So can people with allergies to penicillin get vaccinated?
Yes, they can. There's no crossover at all with penicillin allergy. Again, as was described earlier, the person should take that information and present that when they go to get the vaccine, and maybe they'll be asked to sit there for an extra 15 minutes, but it isn't a contraindication at all to getting the vaccine.
So I'm going to try to combine questions here because there's two questions about, there's a lot of unknowns about this vaccine, and so we're waiting on data. So, you know, with the vaccine getting out as quickly as it has, is there concern that there's side effects that won't show up until further down the line, like months or years later? How much time do we need to take before we know all of these answers to these unknown questions?
Yeah. Wow, that's such a good question. Do you want to talk first, Rachel?
Sure. Yeah. So because when we mentioned vaccines, like, this is degraded in your body very quickly, right? So the side effects that we look for are most likely to occur right away. Now, is it possible that something could happen down the line? Sure, that's why we're monitoring it, but it's the further you get out from the vaccine, the less likely you are to have any side effects related to it. What I've heard from like previous vaccines is like, we'll probably monitor it intensively for like 2 years just to make like 100% sure. But it just, like, the further out you get, the less likely, like, just biologically, that it makes sense that any part of it that got into you would cause any sort of side effect that substantially decreases over time.
Let's see. What is the SHY app for vaccine registration?
What's what?
The Chicago app for vaccine registration?
I'm not sure what app this is referring to. Right now, we do not have an app to sign up for vaccination because we're only vaccinating healthcare workers. So we have like a separate like survey that we're using to recruit anyone who meets 1A priority for healthcare workers. We may end up using some sort of apps in the future, but I think we're kind of working out of the Protect Chicago framework. So like, we'll be using like the Protect Chicago design and workers to be like facilitating any of that if we go that direction.
Okay, let's see. Bear with me, making sure I don't miss anything. So many great questions. Once everyone is vaccinated, how long until things get back to normal? You all have insight on that?
Should be pretty quickly after everybody's vaccinated. I don't know how to answer that exactly, but I think as time goes on and more people get vaccinated, and we see that there's effectiveness not only for the individuals, but for the population in Chicago overall, that it'll become clearer and clearer what the percent of people is that needs to be vaccinated in order to bring down the number of COVID cases.
Yeah, so a great question. I think like at the beginning, while we're still trying to figure out, make sure everyone's getting vaccinated, how many people in these high risk settings. So we're hoping, that once we do like the nursing homes, assisted living, that's made up a ton of our hospitalizations and a ton of our deaths. So getting those super high risk people will kind of free up our hospitals, keep us from having ICUs overloaded, and all of those things will help us to reopen. For the beginning though, we're still like using any reopening metrics, we're still going to be looking at cases. So how many cases are here right now? What's the test positivity? All the stuff we've been doing all along to guide reopening or what businesses should be opening. We are sticking with that for now. There will be a time in which we like kind of transition to like what percentage of the population is vaccinated, but we're kind of looking at both of those to see when that makes more sense as a metric. Right now, we're not at all there. So still for like the next several months, looking at cases, test positivity, and hospitalizations.
What is a reliable source of information on vaccines?
CDPH website.
Yeah.
CDC.
Yeah, I personally feel like it's information overload. I don't know if you guys feel like that as well. So I kind of try to stick to just like a couple places I know I can trust. Like I said, do think the CDPH website is pretty good, not just tooting my own horn here, but like I think it's like easy to read and there's some pictures on there that are helpful, and we're gonna increase that more and more and more as much as we can, having visualizations and infographics and stuff like that. The CDC is also very detailed and they've answered a ton of these questions. It's kind of a little bit more scientific jargon. So if you like, I think start with the CDPH website, and then if you want to read more, you're interested in where did this come from, the CDC is kind of like a more extensive, like, you know, several pages on why this is or what does mRNA vaccine mean and stuff like that.
A couple more questions. Does the mRNA vaccine change my DNA?
No, the mRNA doesn't get anywhere near your DNA. That messenger RNA gets into your cells, but your DNA is in the nucleus, which is another compartment inside the cell. And the messenger RNA doesn't get in there at all, and it doesn't interact at all with your DNA. That isn't its role. It isn't exactly the same thing. And really the messenger RNA is only coding proteins, you know, the spike protein. So no.
They're never even in the same room as each other. They're never even gonna meet.
Let's see. Why do you think healthcare workers are refusing the vaccine?
Well, healthcare workers are a subset of all of us, right? And so there are healthcare workers that some are not in particularly high risk of contagion. They're not around people with COVID, so that could be a reason. But I think healthcare workers also have the same fears and maybe the same prejudices as a lot of other people. So I think those are the reasons.
Yeah, I think so too. And I think, because I'm friends with a lot of doctors just from having gone to school and such. And one of my doctor friends was saying she wasn't sure if she wanted to get it. And I was like, interesting, tell me about this. And like, why do you think that? And she's like, you know, it's just new. It's just new. Like, I just want to see, like, let me get some more information. And we're seeing that in Chicago too, where people are just like, hey, it's just new. Like, let me just see. But as soon as we start talking to those people, like addressing their concerns, answering their questions, showing them resources, we told a couple of hospitals told us they have converts where it's just like once people see their friends getting it, no side effects, everyone's doing fine, people are interested. So I think it's just new, and any outreach that we can do to explain that this is safe and that everyone is tolerating it, great, like will help these people to be more just, you know, accepting of it.
Yeah, I felt like that too right in the beginning, just a little bit nervous about side effects, whether it would be effective and so on. But I read a lot about it, and really, as I said before, the minute it came out, I was there, you know. I already felt confident, but looking at the ravages of COVID in society, how it's wrecking the city and wrecking so many people's lives, to me is influential enough. We have to get over that. We have to stop that.
Thank you. So just doing a time check, Dr. Bernard, I think do you have to drop off?
I do, yeah.
Meeting? Yeah, so just before you hop off, was there anything I didn't ask that you wanted to just talk about, or any final words to share with the group about vaccines?
I think like you guys asked really great questions. If you're asking these questions, you know everyone you're going to be talking to is asking these questions. So we're interested in hearing what you're hearing. And if you keep hearing the same stuff over and over again, please, please, please pass that forward to us. We're happy to do videos. We're happy to do outreach. It's just like a lot where there's a lot to do right now, but that's why we're looking for like what's coming up over and over again and how can we message around that. So we appreciate all of your guys' help, and I'm here. So if you have questions, like I'm happy to do another one of these or whatever is needed.
Great, thank you so much. And we probably will need another one. So many more questions. And thank you, Dr. Forst, as well. This has been great. I know we still have a few outstanding questions, but for the sake of time, we're gonna pause now so folks can take a break. Any questions we didn't get to, we'll follow up when we're recording the sessions. Just want to remind folks of that. And then there are a few questions that we didn't get to, but we'll make sure to follow up so you have that information. So for now, I just want to just take a break and have us all come back in about 10 minutes. So at 3:40. So get a water break, stretch, and then we'll come back and we'll continue our conversation.
Thank you.
Thanks, everyone. Back in Hey everyone, I know folks are coming back. We'll get started in just a moment. Hi everyone. If you're back, can you put hello in the chat? Just want to gauge how many people are back. Oh, okay, see some hellos. Thank you. Thank you. All right, well, let's go ahead and get started. This has been a long day, and I want us to be able to wrap up. Thank you all for the hellos. So first, I just want to say, and stop and pause and recognize that there's a lot going on right now. If anyone's looked at social media in the past couple of hours, there's just a lot going on right now, and it's really scary. Please give yourself permission to disengage if you need to. We have about 45 minutes left, programming today, and I'll talk about what's left on the agenda. But we are recording. I understand completely if it's hard to concentrate, if you need to step away. If you have family in the area where things are going on, I mean, we totally understand. So just take care of yourselves, and we will make sure that you get the information that you need from this event. So for the rest of the time here, I wanted to turn it over to Patrick Stonehouse at CDPH to share, now that you all have taken in all this information, what does this mean for the contact tracing core? What are some opportunities for the core, to engage in some of this vaccine education and rollout? We'll talk a little bit more about resources, and then we wanted to spend a little time in breakout sessions, providing folks an opportunity just to debrief from all of this information that we've given to you. But again, I just want to reiterate, please feel free to and give yourself permission, disengage if you need to, and then we'll wrap up. So I'm going to turn it over to Patrick right now. Patrick, if you're back, and then we'll continue from there.
Great. Thank you for that, Melissa. I was feeling a little shaky myself and being like, maybe we should take a moment of silence and sort of recenter. So yeah, thank you for the reminder. Like, if we need to take a minute, it's all good. Afternoon, everyone. My name is Patrick Stonehouse. I'm with the Chicago Department of Public Health. I use he, him, his, or masculine pronouns, or anything with respect is fine by me. Pre-COVID, I was Director of Public Health Operations for the CDPH HIV programming, focusing on HIV prevention and sort of looking at systemic and structural barriers, like the things that would have to change in a system in order to try to bring about improved health outcomes for certain populations that were highly impacted by HIV and other elements of like poverty and white supremacy and all this other stuff that just keeps getting more and more pointed out as being a continuing issue that we need to address both in COVID and in the rest of our lives. And so yeah, this is all, the implications for this are manifold for the vaccination. And actually, before I do that, I just want to, as part of my centering, I just want to say a special thank you to Michelle Howard, whom I see as a participant of this particular meeting. Michelle Howard used to work with CDPH, used to work with me in the HIV programming. So, hey, Michelle. It's just nice to see names of people whom I care about doing well and rocking it out. So when we go to the implications for the contact tracing core from vaccination rollout, there's a couple of different or several different points involved in it. So one is we are all people who in one way or another have been impacted by COVID or are currently being impacted by COVID, whether it's directly or indirectly. And so part of our efforts in doing sessions like this and more efforts that are going to be going on is really just to get as much information out there as possible so that we as people have as much information as can be distributed. I want to say up front that information, data is a tool, but so is empathy, so is human interaction to address the concerns that folks have regarding the COVID vaccine, regarding COVID in general. I don't like referring to people's concerns as myths because, as the panelists during the Q&A spoke to, like, those concerns are based in reality, right? And so the human interaction is the way to address that, and doing some one-on-one conversations with folks, as well as putting forth commercials and public service announcements and all that. But really, like, our point is that we just want to get all this information out. We want to have honest conversations with one another. And we want to support you as the contact tracing core in having honest conversations with your friends, your loved ones, your lovers, your neighbors, your colleagues, whomever, and also having honest and open conversations back with us at the health department, letting us know what is working, what isn't working constantly. Like, there's almost, it can't be too frequent of communication. And if we have to, like, hit the same questions over and over again, that's what we have to do, and it's okay. So there are, like, when we started the Chicago Community Contact Tracing Core and the Resource Coordination Hub, the idea was, like, there wasn't a vaccine at the time, right? So we knew that we were going to need just this massive workforce of folks who are well trained and are passionate about the work and are able to go and do the contact tracing and the resource coordination. And we knew that those efforts at contact tracing and resource coordination would be hugely important. And it still is. So even with the vaccine coming out and the implementation of vaccination pods, contact tracing and resource coordination are still huge and important efforts that we're going to continue to do. Now that the vaccine's out, we have to consider, like, all right, can we do that too, right? Like, so what is the balance of the workforce that we have, be it the contact tracing core, the resource coordination hub, CDPH staff, other City of Chicago employees? Like, we have to figure out what is the balance across all of these different efforts. And you all know, as contact tracers and resource coordinators and supervisors, that, like, we're not seeing the numbers of contacts coming through the system to make it so that, like, this 600 plus person workforce that we've got is, like, busy all the time. And so we're trying to figure out, how can we sort of merge these efforts and blend these efforts so that there is a balance within the contact tracing core. Because just so you know, we at the CDPH in the efforts to staff these vaccination points of distribution, I've been like calling out to all of the other departments of the city, being like, hey, can you like detail some folks back over to us so we can do some of this work? And so we're looking for everywhere, looking everywhere for folks to come in and do the work that needs to get done. And so, you know, the Chicago Cook Workforce Partnership has already sent out a survey about a month or so ago to all of you, asking for your interest in doing some other things outside of contact tracing, whether it's doing some peer-to-peer texting, which I've actually received recently, and it was pretty dope, to working at these vaccination points of distribution when they become implemented, which is happening like now. So we have, as of earlier this morning, been asked to try and identify 100 folks who are going to be working full-time on the vaccination pods, points of distribution, starting next week. So it's real that there is an impact on the work that we have been doing with contact tracing and resource coordination, because there is this other need for working on the vaccination pods. There are some other efforts. So like we've already got, I think 10 folks who've been identified to participate in doing some registration for vaccinations that was mentioned earlier, you know, like calling out to manufacturing companies, dentist offices, home healthcare providers, and working with them to identify to get their folks registered to get vaccinated, because they're part of those initial rounds of vaccine. And just in the first week, I think it was like 2,500 folks got registered through that process. So it's a massive effort, as was alluded to by Dr. Bernard earlier. Like, so there's no shortage of need for work. So I just want to be clear, as we are working on like maybe asking or maybe pushing folks to do some work with the vaccination effort as opposed to contact tracing. It's not like we don't need the 600 plus folks in the contact tracing core. We need all y'all. We just need to shift some of the efforts that are going on. In addition to those efforts, like we're also working on doing some work around what could, and this is like very, very early stages of creating some programming that could be like vaccination ambassadors. So some training and supporting individuals to be ambassadors within your communities around vaccination. And I want to put forth that those efforts, all of these efforts, do need to be bi-directional, right? It needs to be sharing the information that we have based on our science, and it needs to be also accepting the information that is based on experience from everybody, from your neighbors, from yourself, from me, from your families, and from your lovers and your churches. Taking that very real experiential information and passing it back over to us so that we can continue to address it to the best of our abilities. There's also opportunities for folks to get involved in some of the hyper-local efforts that are being done. So like, I know of 3 right now. So the Belmont-Cragen community area has been doing a lot of really awesome local resource coordination and education and outreach and information sharing efforts that folks can get involved in. Southwest Organizing Project is leading some efforts doing similar work in 60629 and 32. The 22nd Ward is doing some stuff as well that I know, I can't remember which of the community-based organizations is involved in it, but like the folks are already involved in it, and there's much more opportunity for us to get involved in some of these hyper-local efforts as well as these citywide efforts. And lastly, on that stage of like the other things, I do want to continue to support in the Chicago Cook Workforce Partnership and the rest of UIC and Sinai Urban Health Institute and Malcolm X City College and NORC. Like we're all also very supportive of you coming up with things. Either you as the contact tracing core or you as the specific community-based organizations coming to us and saying like, based on what we're hearing from our folks, from our constituents, from ourselves, these are some efforts that we want to put forth to support contact tracing, to support vaccinations, to share information, to identify other barriers that folks are experiencing. We just need to know what those things are so that we can like support and honestly, like monitor those things. I'm not gonna lie about it, but like we want folks to be coming up with ideas based on your knowledge and expertise, because you are experts, of what you think can be done, provided like the information that is involved is accurate, and provided that we know about it. Like, I don't have a problem with it. We just need to know, because we want these things to be as effective as possible. So all of that is like things are changing constantly. Things were changing before, like when testing started happening in large scale. Contact tracers were getting lots of questions about testing, and so now that vaccination's happening, like I know folks are already getting lots and lots of questions about vaccinations. And the website that CDPH has is pretty solid. Like, there's a lot of really cool stuff on there. So I definitely encourage you to take a look at it, download some of the documents that are available there, disseminate them wildly, or just share that stuff everywhere. Go for it. But also, like, let's work together to create some other opportunities for sharing information that are yours. So the last part I want to say in terms of the implications of the vaccine, we're not done. And even with the vaccine, like, I have lots of concerns about, and I think everybody does, and these have been articulated pretty clearly, about like concerns about inequitable distribution of the vaccine. So we gotta remain vigilant in making sure that we're doing everything we can by those folks who have been historically left behind by like a white supremacist system, where we're not providing the resources, we're not providing access. We need to remain vigilant and stay on that stuff to push. So that I know there was a question during the question and answer period about like when we get back to normal. And like, there's a part of me that, this is always sort of a scary thing. Like, I don't want to get back to normal. I want to get to better than normal. So pushing ourselves to when we are out of this, we're not back at where we were in 2019, where like we're in a new place that's even better than where it was before. And part of that is honestly, like, when we put together this contact tracing core and the resource coordination hub, the ideas were like, yeah, we wanted to have an immediate response to an immediate threat, which is COVID. We absolutely needed the personnel, we needed the workforce, we needed the expertise, we needed the knowledge and the flexibility that you all provide. But we also wanted to build jobs, right? We wanted jobs in places that had been historically neglected by resources and by job opportunities. And we wanted more than just part-time jobs or temporary jobs. We wanted paths to careers. And so that's why there's this whole earn and learn component of the contact tracing core. We want these positions that you all are in to be starting points or paths, if you need them, to become public health professionals or become professionals in some other way, shape, or form. And that's, again, where these opportunities like working at vaccination pods and the call centers present themselves as like, these are further opportunities to gain some professional experience, to gain some knowledge, to gain some exposure to other opportunities. It's all just towards building the opportunity for you as individuals, but also toward what we think of as being like one of our bigger goals that's beyond COVID, but includes COVID, which is like we at the health department, when we put this whole thing together, one of our hopes was that it would build toward regional or community area specific public health cores, or just like groups of folks who have information, who have confidence, who are respected, who have access, and who have the ability to communicate out the necessary information to address some of these systemic and structural barriers that folks have been experiencing for generations. And so, when we think about public health, modern day public health, like the foundation of it are, contact tracing and vaccination work. Those are like huge. So the need for those are never going to go away. The opportunity presented by these efforts are also huge, to create pools of people, of yourselves in community areas who know stuff, who like have the latest information, who also like know equally important stuff. They're like how folks feel in my community, like talk to folks about it, who have ears, who have mouths, who have voices. All that stuff is tremendously important, and in my estimation is what we're going to need in order for us to exit this current situation we're in, to get to someplace better. And so again, like, it's about the communication, it's about the opportunity, it's about the information going back and forth. So telling us what we're doing that is working, telling us what we're doing that isn't working, and working to fix it and working to get it right, and coming up with their own stuff to get out into the communities, into people's ears, to address the concerns that are totally legit, and to work our way through it. So the implications are huge, both on within the job, within the contact tracing core, within COVID, broader, within economic and job opportunities, within career paths, within general equity. Like, it's all massive, and I recognize that I'm a little bit rambling, but again, a little bit shaken by some of the things that are going on in DC and others. So I just want to end my little thing with just, again, a thank you to all of you for the work that you are doing, have been doing, and are going to be doing. Y'all are inspiring. So thank you.
Thank you, Patrick. If anyone has questions for Patrick, please feel free to put them in the chat. Even if we can't get to them before we wrap up, we'll make sure that he gets a chance to answer them for you. So